So remember, as you're approaching your patient, you want to perform your PAT. That's your general impression or your doorway survey. It does not replace your primary.
All right, so looking at this patient and thinking about the pediatric assessment triangle, you can see that she's working pretty hard to breathe. She's tripoding and has some pursed lip breathing. She appears to have pretty good circulation at this time, but she just doesn't look great. I think that we're going to call this a quick kid.
That's right. It only takes one side of the triangle to fall out to make this patient quick.
Hey, hi, how are you?
Good, how are you?
What's going on today?
Hey,
You okay? Got a good radio here. Give me some ears.
See what the pediatric assessment triangle looks
What
like.
happened
on her.
today? A little rapid on the pulse.
Okay, put some ears on her.
I want to take a listen to your lungs. Why don't you talk to my partner? Let him know what's going on.
So can you tell me a little bit about what happened?
We've just been playing outside for like 10 minutes.
talking.
Okay, good. Airways
All of
open.
a sudden she couldn't breathe.
Okay. So we got increased work of breathing, appearance
Wheezes
looks okay,
throughout.
wheezes
Yeah.
throughout.
Pediatric assessment triangle. I'm gonna give
Circulation to
her
the skin.
a quick here.
Okay.
Okay, you got her
Color
hooked
quick.
up.
We'll put her on end tidal and
Start out. Yeah, if you want to.
Now that they've reached the patient's side, they've done their PAT and done a quick primary assessment, and they've decided this is quick.
okay. Mom, if you don't mind coming over here,
Yeah, we got a.
ask you a couple questions.
Sounds like a little bit of asthma. How old is she?
She's 8.
8. Okay, cool. So 8 years old. We're gonna work on some albuterol.
I can start putting her on the monitor.
3 mil.
I see a good use of crew resource management here, and I'm glad they got that hand-heavy book out early and opened up to her age.
Absolutely. It helps you do a couple of things and make sure that we're giving the appropriate medications. Even though we are using that, we want to make sure that we still IMAC everything, correct?
Yeah, that's right. IMAC's important. We want to make sure that she gets the right dose and that we're giving her the right medication. Also, I like that they're addressing breathing and getting that oxygen out early.
Okay. All right. So what was happening when when your daughter started having a hard time breathing?
We've been playing outside,
Okay.
and then like 10 minutes into it, she just started getting really short of breath and she kept saying she couldn't breathe.
Okay. So shortness of breath. And can you tell me if she has any allergies at all?
No allergies.
Okay. No allergies. What about medications?
She does take an inhaler for
She takes an
asthma.
albuterol inhaler.
Yes.
Okay, guys, she takes an albuterol inhaler for her asthma. All right. Okay, so is that the only medicine she takes?
Yeah.
And
Yeah.
then, can you tell me anything about her history other than the asthma?
No, I mean that's just
Just
about
the
it.
asthma?
We don't have the inhaler. We ran out
Okay.
a few months ago.
Okay. What about the last meal that she ate? Anything different?
No, it was maybe an hour ago.
Okay, and she
Nothing
was
different.
playing, and then
Yeah.
that started happening.
Mhm.
Okay, and then when this started happening, did you start to notice it was a quick onset, sudden onset?
Yeah, it just came on really
Okay,
fast.
Okay.
Yeah.
And does anything seem to make it better or worse for her?
The inhaler helps.
Okay, that seems to help. Okay.
Yeah.
So, guys, seems like sudden onset. She was playing, started having a hard time breathing. She does take an inhaler with albuterol, so we can go ahead and get that rolling for her. We said quick on the pediatric assessment triangle, and we'll load her up and start transport.
Sounds good.
Okay.
Feel a mask on your face. It's gonna feel a little weird, okay? But I promise you, it's gonna make you feel a little better, okay? Okay, we're gonna lie about something. Okay, dude, you got it? Okay. Are you working on the stretcher?
Working on
We're
the
gonna
stretcher.
transition
Alright, I'm
over
gonna
to
put
the
it over
group
your
ears
I
here.
have the neb ready to
You
go.
got it? Okay,
Yeah.
cool. I'll tell you what, if she's on. Let's see. She's on high. You got it. Ready to go?
I'm ready
Okay,
to
cool.
rock.
Well, let's just transition her over and then we'll get her moved. So listen, I'm gonna put this right in front of you, okay? And you're gonna hold it and you're gonna breathe into it, kind of like a kazoo, but you're gonna do the reverse.
All right, so let's talk about this. They put her on some oxygen, so they're addressing the breathing. I think that they could probably move her to the ambulance and do the breathing treatment in the back, or they could have just started out by putting her on the mask with a nebulizer. So they're addressing the breathing while they're moving her over. She's a sick kid, so we want to make sure we're not delaying any transport. What do you think?
Yeah, exactly. I think I'm okay with that, with the number of people that they have on scene. And if they can get it done quickly and not delay getting the patient moving to the hospital, I'm okay with it. Remember your IMAC, and remember to make sure your patient does not have any allergies before giving medication, correct?
Yes, absolutely.
Okay? Make sense? Alright, so this on here, you breathe this in. In here. Let's try it. Cool. Put it in your mouth. You can breathe it in. Alright, nice deep breath. Nice deep breath. There you go. Nice and slow. How we doing on the stretcher?
We're ready to
All right,
go.
guys.
We're
Okay,
lowered.
cool. Awesome.
Now that we got her
There
on the
you go.
treatment,
Yeah,
it's
yeah,
9:02.
yeah.
Let's get her out of here.
Yeah, I'm with that.
I have monitor and a can of air.
Okay, I'm gonna unravel her lines here. Cool. Yeah, the hand heavy. Here, do you mind taking it out when I got her over? Okay. All right. You're gonna feel me just kind of reach right under you and pick you up. Is that cool? You all right with that? All right.
All right, so they're getting her off scene pretty quickly, so that's good. When we get into the back of the ambulance, we're going to work on starting our secondary assessment because we're following that systematic approach.
That's right, the systematic approach.
So what are they going to do in the back?
So in the back, they're going to reassess. They're going to get vital signs, monitor. I noticed they put the monitor on scene. I don't know if I would have particularly have done that at that point. Again, they've got a lot of hands. There's a lot of things going on, so I'm going to let that one slide maybe.
Yeah, do they have her on capnography?
Oh, good question. I do not see any insight.
I think I would have put some capno on before
Absolutely.
I started thinking about the monitor because
Right
we're looking
off the
at a
bat.
breathing problem here.
Right off the bat.
Yeah.
So we're going to get in the back of the ambulance. We're going to do those things that we've missed. We are going to make early notification to the hospital because early notification is what? It's key, Jasmine. Early notification is key.
All right, cool. So I think that we'll have the hospital ready when we get there and everybody knows what we're doing. So, yep.
If you need help, let me know.
There you go. I got it. All right.
Excellent.
There you go. I'm gonna spin in front of you. Got it. All right. Get you set up here. 2, 3. Mom, we're gonna take you to the hospital, obviously. Okay.
Okay.
You got a pediatric hospital up here. East Countryside, right?
Countryside,
Yeah.
yep.
Cool.